Kuya Edward, maaari mo ba silang bigyan ng payo?
Good morning, family. Payong po. Wala po akong payong joke. Um, this is our seventh day na? Eighth day? Okay. Ang payo ko lang is more effort.
Thank you, Kuya Edward. Maaari ka nang umupo. Mayroon pa bang gustong magbigay ng pangaral sa mga kapwa natin na tumayo? Kung wala na, maaari na po kayong umupo, mga ate at kuya. Maraming salamat sa inyong pagtanggap. Sino-sino sa susunod po na community business natin, sino-sino sa ating family ang nakapag-violate ng house rules na stay awake o yung inaantok-antok during ng training natin? Meron ba sa ating family ang nakapag-violate ng house rules na ito? Maraming salamat sa mga tumayo. Sino-sino sa family ang gustong magbigay ng pangaral? Kuya King, maaari mo ba silang bigyan ng pangaral?
Good morning, family.
Yun ako. Okay, yung ako man din po ay inaantok ng mga unang araw ng ating training. Pero kapag eventually po kasi is na may enjoy mo na din po, especially pag may mga activities. So, ah try nating tawag doon, isa puso yung nile-lecture and magugulat kayo na parang hindi na kayo aantokin. Thank you.
Maraming salamat, Kuya King, sa binigay mo pangaral. Meron pa ba sa ating family ang gustong magbigay ng pangaral? Kung wala na, maaari na pong umupo yung mga tumayo. Sa susunod po, sino-sino sa ating family ang nakapag-violate ng house rules na be punctual? Sino-sino sa ating family ang na-late kahapon? Pati po ngayon sa pagpasok. Ayan. Sino po sa ating family ang gustong magbigay ng pangaral sa mga kuya at ate natin na na-late? Kuya Dan, maaari mo ba silang bigyan ng pangaral?
And good morning, family. And we only have 2 remaining days. No? So, sayang naman yung mga lessons na magagain natin if hindi natin mas mamamanage pa yung time natin. So, make sure na starting today, saka sa mga remaining days, mas aagahan natin. We will make sure na hindi tayo madali. Thank you.
Maraming salamat, Kuya Dan. Meron pa ba sa ating family ang gustong magbigay ng pangaral? Kung wala na, maaari na pong umupo. Maraming salamat sa inyong pagtanggap. Diyan po nagtatapos ang ating community business ngayong araw. Turn over to you, Fasi.
Salamat. Okay. All right, so we start a new topic today. And it's cognitive behavioral therapy. Okay, sino ang pwedeng magpaliwanag ano ang ibig sabihin ng o ano yung cognitive behavioral therapy? Diba theory yun, di ba? It's one of the theories in psychology, no? Sino pa yung paliwanag? Ano ang cognitive behavioral model or theory? Anyone? Okay, Ivan.
It's a therapy approach wherein the goal is to change the cognitive of the person because the thinking. So the cognitive is being changed because it affects how the person feels and how the person and therefore how the person feels affect how the person behaves and therefore how the person behaves affect the result and therefore to change the result, we go to the root cause, which is the cognitive.
All right, that's the application of the theory, right? Cognitive. So cognitive behavioral theory is a fusion of which two theories of psychology? Ano yung pinagsama para magkaroon ng cognitive? Ano yung theories? Okay, so anong traditional theory about human, how the mind works, how people behave? Sino ang unang nag-propose noon? Yes, Freud. And out of Freud's theory, we came up with what? Anong theory? Psychoanalytic theory, right? Okay. So, which deals mostly with what? The unconscious, right? Yeah? Right? The mind, and particularly the unconscious. The mind, particularly the unconscious. Okay, so what's the other? Okay, if we look at like a spectrum, focusing on the mind and the unconscious, what's the other school? Sino nagsabi nun? What's the other school? Huh? Ano yung other school? Oh, sabihin ko na, Skinner. Anong school? Behavioral, right? Okay. Behavioral. So you have one which is actually just the mind and the unconscious, and one focusing on just the behavior, right? Okay, so behavioral theories came out. Okay, and then what happens after that? Some people actually begin to fuse, right? The two theories, or hit like a middle ground, using some of the theories of the mind, and the other one is looking at behavior. Ano nangyari doon? What's the third one that came out of it? Yun yung cognitive behavioral theory, di ba? So, cognitive behavioral theory is, borrowed from, they were saying that, the mind is still very much involved in human behavior, right? And it's not just the behavior, it's a combination of the mind and the behavior. So then we have the cognitive behavioral theories, right? So, sino mga alam yung proponents ng cognitive behavioral theory? Oh, Aaron Beck is actually cognitive behavioral. Yep. He specializes in depression, right? Yes. Okay. Sino pa? Besides, Bandura is another one, right? Yeah, but also, he's also social learning. Di ba? Sino pa mga proponents ng cognitive behavior? Come on, psychology. Nakalimutan ko yung psychology ka. Wala ako sa eskwela. Kayo mga fresh pa lang kayo eh. Si Ellis. Albert Ellis, yes. Ano yung therapy ni Albert Ellis? Ha? Ano pangalan? Rational emotional, yes. Rational emotional therapy. That's si Ellis. Okay. So marami yan. If you really look at yung nila, no? So kind of yung criticism nila ng Freudian psychology or psychoanalytic, and then purely behavioral. Di ba, may point sila na hindi po pwede yung lang magkapag-explain ng human behavior. Hindi lang yung mind. It should be like a combination of both. So, then we have the cognitive behavioral theory. Okay. Then they came up with a cognitive behavioral therapy. It's actually very simple. Think of a triangle. Okay? The triangle like this, you have behavior, thinking, and feeling. Right? Okay, so that triangle is very important in cognitive behavioral theory. All right, katulad sinabi nga ni Ivan, no? The mind influences behavior and feelings, right? Okay. All right, so That's what we will look at. Okay. Ayaw. Okay. Thank you. All right. So, what is it? What is cognitive behavioral theory or therapy rather? It's a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and several mental illnesses. Okay? Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated. In many studies, CBT has been demonstrated to be as effective as or more effective than other forms of psychological therapy or psychiatric medications. Okay. So that's what CBT is. Okay, yung core principles ng CBT. Psychological problems are based in part on faulty or unhelpful ways of thinking. Right? That's, you see that, right? You know, yung, di ba? Sometimes sinasabi natin, ano yung iniisip mo, mangyayari yan. You know? Okay? So the mind has a lot of influence on how we feel and how we behave. All right? So there is, you know, kind of a common sense thing. We see that, right? Psychological problems are based in part on learned patterns of unhelpful behavior. Di ba? Yung habits, bad habits particularly, you know. So you can look at drug addiction as a habit. It's a bad habit, no? Okay? People suffering from psychological problems can learn better ways of coping, thereby relieving their symptoms and becoming more effective in their lives. Okay, so those are the three core beliefs of CBTs. Okay, so tingnan, ano naman ang treatment strategies nila? Okay, so the focus is in changing the thinking patterns, right? The cognitive. Learning to recognize one's distortion in thinking, right? Yung maling pag-iisip na nakaka-contribute, no? Doon sa ating problema, and then to reevaluate them in light of reality. Realistic ba yung yung paniniwala mo? No? Kasi minsan yung paniniwala mo hindi consistent dun sa reality, no? Pinaniwalaan mo lang yun. And yet, yung paniniwala mong yun shapes your behavior. Di ba? Okay, so yung palang behavior na because of that distorted thinking, yung behavior na nagre-resulta dun sa maling pag-iisip mo ay dysfunctional. Hindi, no? Hindi adaptive behavior. It causes problems, no? Yan ibig sabihin. So, gaining a better understanding of the behavior and motivation of others. Okay? So, alamin natin ano ba ang ano ang motivasyon. What is driving that behavior? Kailangan maintindihan natin yun. So, they focus on understanding the behavior. What underlies that behavior? And, they look at the mind. How does the mind contribute to that behavior? Yung bang takbo ng isip ay may diferensya? So, kung may diferensya yung takbo ng isip, mag-focus tayo dun sa paano natin baguhin yung paniniwala niya, yung beliefs niya, no? So, that's part of the strategy. And then using problem-solving skills to cope with difficult situations. What happens in problem-solving skills is it's also a change in cognitive, no? It's a different way of looking at things and problem-solving, no? Siguro stuck ka in doing thing over and over, repetitive behavior na hindi naman talaga, hindi adaptive, no? Pero paulit, ilang alam mo kasing gawin eh. Para bang yung mind mo stuck in it, stuck in doing. You've seen people do that. Keep repeating. Alam nila na it's not working. It's still doing it over and over and over. Like he is stuck, right? Okay, so the intervention there, cognitive behavioral, is understand, what it is, about the mind that gets him stuck. What belief, wrong belief, or dysfunctional belief is making him repeat that behavior over and over and over. Learning to develop a greater sense of confidence in one's own abilities, no? Yung taasan mo yung level of confidence ng tao na kaya niya talagang gawin ito, no? Which is across the board, no? Even in MI, di ba? We increase the level of confidence. We call it self-efficacy, no? To help a person really succeed in what he's trying to do. Okay, so those are the strategies, right, of cognitive behavioral therapy. Oh, we have more. Efforts to change behavior patterns by facing one's fear instead of avoiding them. Oh, di ba, based on this principle or strategy, what therapy did cognitive CBT, actually this is more behavioral, more behavioral approach. Anong common therapy came out of this? I'm sorry? Exposure therapy. Yeah. Exposure therapy. What else came out of this strategy? Exposure therapy. I'm sorry? Oh, systematic, which are actually now, we're going into the area of behavioral therapy, right? But cognitive, like, it's a marriage of actually, of purely like the psychoanalytic, which is the thinking part, and behaviorism. Okay, so, all right. So those are actually phobias, no? Very effective in phobias. Okay, using role playing to prepare for potentially problematic interactions with others. Role playing, practicing the behavior, right? To practice the behavior. Okay, so that's part of the strategy. Learning to calm one's mind and relax one's body. So yan, we have the relaxation exercise. In fact, maraming mga relaxation-related therapy, right? Nandiyan na yung mindfulness, yung adaptation of yoga, breathing exercises, right? Inadapt din nila yan. Because all of those things actually has effect on the physical body. How you calm an anxious person, for example. How do you calm him down? Just focus on your breathing. Grounding is actually based on cognitive behavioral therapy, which is very effective in calming a person down, right? Okay. So, who has practiced cognitive behavioral therapy? Anyone? Have you tried it in your counseling? Have you seen it work? In other words, in your practice, have you seen it work in your practice? Who has experience in adapting or using cognitive behavioral in his counseling? Have you ever tried, Ivan? And what happened?
Not really the entire principles of CBT though, Doc. It's just the activity of CBT, just like the positive self-talk and the ABC model of CBT. That's like practicing to change the thinking so that his feeling and behavior would change. So those things. And yeah, I can see it working naman po, Doc.
Ina-apply.
To my a patient in the center and private clients as well. And to myself.
Oh, you practice CBT. Okay, to yourself. Anyone else? Sino nakapag, apply ng CBT and really got some results? Yeah. Anyone? Okay. Philip, did you try CBT? Okay.
Doc, We have a patient na na-diagnose with generalized anxiety disorder. And along with pharmacological therapy, sinabayan ko po yun ng CBT, cognitive behavioral therapy. So, yun lang, Doc. First, pinactice niya din yung relaxation technique. And same, Doc, yung nasabi ni Sir Ivan, yung ABC model, yung i-change mo yung line of thinking niya para mag-create ng ibang behavior. And very effective naman, Doc. So far, yung patient po natin na-stabilize na yung coping and wala nang incident na nag-occur yung anxiety disorder.
All right. So it really works in no, it works. It works in certain cases, no. I would not say that you can use CBT in every case, right? But you know, many of the really hindi yung severely dysfunctional, no, na na problema, you know, yung bang simple problems of life ba na hindi siya makapag-cope o takot siya sa sitwasyon, no? We can use CBT yung, but you know, like people with agoraphobia, you know, no? It gets a little bit complicated sometimes, no? But they try that, they try arachnophobia. They, exposure therapy, you know, ginagamit sa mga ganun. Okay. So it does. You know, I will not say that it will work for all types of people, all types of patients, but there is a use to cognitive behavioral therapy. You know, I'll tell you a story. You know, where I was new to this. No, I was just learning CBT when I was doing my graduate school in counseling in UMKC. So one day I was about. This was my last week in that agency. I was doing like it was an outpatient private practice, right? So I was one of the therapists there, so, and that was my last week before I moved to New York. She was my last client actually. So she came in right that afternoon, and good-looking black girl with a daughter, right? She walked into my office and she looked depressed. She looked depressed, no? And then I asked her, I said, what brought you here? And she said, I'm depressed. I stopped smiling. He said, I stopped smiling. And she really looked depressed, right? You could see her head and the way she was talking. And she told me, I stopped smiling. Right? I said, how can people stop? So in my mind, no, stop smiling. So right away when she said that, I cracked a joke. I cracked a joke when she said that. I forgot what the joke was, but she started smiling, a big smile in her face, right? And so I commented to her, I love your smile. You have such a beautiful smile. And then and he said, and she looked at me. I smiled. I said, you did. I said, you did. You smiled. So she was quiet for a while, and then she said, can you excuse me? I said, sure. So I thought she just wanted to go to the toilet, right? Use the bathroom. And she took a while before she came back. And then when she came back, I said, so are you all right? I said, I. And then her whole face is different. It's like different. I said, so what's happened? I said, what happened? I said, it took you a long time in the bathroom. She said, well, because I was looking at myself in a mirror and see if I really could smile. And she said, so what? I said, so what did you say? Yes, I can smile. And you know, for the rest of that session, believe it or not, she was not depressed anymore. That was our session. Yeah, I didn't really do anything. I just cracked a joke. All right, and then you know, so even me was surprised. I was so surprised. I did believe though that was you know, when I cracked that joke, I was trying to counter yung belief niya na she cannot smile, because in my mind it's impossible not to be able to smile, right? Okay, so So anyway, so during that session, she was happy and she said, I feel good. I'm okay. Uh, thank you very much. And then so she said, when I'm gonna see you again? She said, unfortunately, I said, this is my last week in the agency. Not the last week. I said, my last week is next week. I can see you for the last time next week. And that would be our last session because I'm leaving the state. I'm moving to New York. He said, okay, so I'd like to see you for next session. No? So come next week, come the following week. She came. She came with a cake, brought her daughter, so I could meet her daughter and her best friend, you know. And then we sat down in the office, and she was a different person, believe it or not. She was well dressed. I told you she was like a good looking black woman, well dressed, nice little girl. And then her friend, and he said, this is my way of saying goodbye with a little cake. So this is, we'll just have a cake. So that was her way of thanking me for the whole thing. And that was like, it blew my mind that, that session, very short, that's all we did, and kind of changed her behavior. I can never forget that. That's probably the most, we are talking about brief therapy. This is the most brief therapy I ever encountered. Okay, so what happened in that encounter? Basically, I challenged her belief that she could not smile. And that belief that she could not smile got her depressed. I'm sure there were other issues in life that precipitated that, right? And because I was able to move her out of that depressive thinking, which is actually caused by her belief, right? I think there will be a lot of things that can come out of that session. Unfortunately, I could not follow up on that one. But the main symptom was actually relieved by just simple encounter that we had. And so from that point on, I really believe in cognitive behavioral therapy. I said, yeah, it can work. Okay. Yeah. So that's my little story about CBT. Okay. Okay. So the general treatment approach. Not all CBT will use all of these strategies. Okay. Rather than the psychological and patient work together, rather the psychologist and patient client work together in a collaborative fashion to develop an understanding of the problem and to develop a treatment strategy. It's collaborative. You have to really work with the client very closely, okay, in this approach. CBT places an emphasis on helping individuals learn to be their own therapists. That's true. Okay, so you teach them the skills, you teach them what they needed to do, and they have to implement it. Okay, so that by itself, if you really think about it, you have to have a highly motivated client for it to work. Okay, so yeah, just consider that, the motivation of the client. Through exercises in the session as well as homework. There's a lot of homework in CBT. Okay, that's the other thing. So that's why I said cooperation and motivation is key because they have to really do the homework. Okay, the homework exercises outside of the session. Patients, clients are helped to develop coping skills whereby they can learn to change their own thinking, problematic emotions, and behavior. Okay. CBT therapists emphasize what is going on in the patient's current life rather than what has led up to this difficulty. So you focus on what's going on currently. So in my approach, I did not ask her, okay, so what happened? You understand? I did not explore that. So the immediate issue there was she looked and was depressed, and I wanted to kind of see if I could use CBT to help her overcome that depression. I still referred her actually to our psychiatrist after that session. So I told her, here is a recommendation: go to our psychiatrist. I'll schedule you uh, for him to see her because probably has real, depression.